Let's now discuss Pianli, the side passage, as we continue our discussion on Han-Yang-Ming large intestine meridian. Pianli, or LI6, is located on the posterolateral aspect of the forearm, soon proximal to the LI5, or Yang. C. LI6 is the Luo-Connecting or junction point of the LI meridian. As the exteriorly related Luo junction point with its partner, the lung, the receiver of Qi, side passage will have a harmonious action on the metal element and help restore a sense of equilibrium. The role of the Po, powered by the breaths of the lung, is to unobtrusively maintain the automatic rhythmic processes of life. When there is distress in metal, one can see extremes of behavior at every level. Mercurial changes in mood, slovenly hygiene, or obsessive cleansing, the restless quest for meaning and value, or rigid matter of fatness, sentimentality about the past, or repression of feeling. The art of the lung is to live each breath fully, as if it were complete, aided by the large intestine's propagation of the correct way of living, which, by eliminating, allows us to transform, evolve, and inspire more deeply. LI6, Pianli, joins the lung meridian and reunites and calms the first and last processes of a being. When intense or long-term disappointment in grief impairs the natural condensing action of the lung so that the upper jaw, the heart and the lungs, is constricted and the large intestine no longer extracts the value of life from the dross, this point paired with lung 7 can release and harmonize feelings which have been repressed and are blocking the potential unfolding of an authentic life. Judgment and clarity and the natural movement of metal to stop and return us to the inside are restored. The lung opens the water passages and LI6 assists the lung in controlling this, which can be impaired in chronic lung qi deficiency or through obstruction of the way or the defensive qi. Local point for wrist and forearm problems. The name probably refers to the connecting channel which travels from LI6 to the lung channel. This point is indicated for rapid changes in mind and spirit, for extremes of behavior, and repressed emotions. It is also for facial and upper body edema due to lungs failing to control the water passages, and also for wrist and forearm pain. Consider this point for problems such as retention of urine or feces, or when a person is holding on to feelings such as long-standing grief or repressed emotion, no longer relevant to the present time. This point can help the patient to let go of this and move on in their life. This point can be used with lung 7 or lung 9 to bring greater harmony and balance to the metal element, both mentally and spiritually. This point is helpful in cases of extreme behavioral patterns or mental confusion. Patients can be dirty or unkempt, or conversely overly obsessive about cleanliness. Consider this point for wrist and forearm pain. Thank you for your attention.